lecture today about ethical practice in the community under supervision Dr. Amel El-said, prepared by Rahab Hassan, demonstrator at Community Health Nursing Department. Outlines: definition of ethics, definition of ethical behavior, source of behavior, definition of professional code of ethics, ethical principle, ethical issues, definition of human rights, basic characteristic of human rights, application of ethics in community. Introduction. Ethics are social value, morals, and principles that guide people in behaviors that are good, proper, and decent. Ethical behavior direct us in our everyday lives as they are ingrained in our society. Healthcare professionals must frequently make decisions based on ethical and legal issues. It is important to learn the ethical principles, the professional code of ethics, and the legalistic in order to be knowledgeable on ethical decision making when dilemmas arise. Universal human rights are often expressed and granted by law in the form of treaties, customary international law, general principles, and other sources of international law. International human rights law lay down obligation of governments to act in certain ways or to refrain from certain acts in order to promote and protect human rights and fundamental freedoms of individuals or groups. Definition of ethics. Ethics is defined as a system of moral principles and values which include good, proper, honest, and decent conduct. Ethics are the social law and value, the social code of right and wrong, and the specific moral choices. Ethics is the discipline of dealing with what is good and bad and with moral duty and obligation. Ethics is a set of moral principles or values. Ethical behavior is not the display of one's moral rectitude in time of crisis. It is the day-to-day expression of one's commitment to other person and the way in which a human being related to one another in their daily interaction. Sources of behavior: family, religion, law, culture experience. Professional code of ethics. Code of ethics describe a body of rules, the principle, and the standard which govern the conduct of its member. Each profession may adopt a code of ethics to self-regulate the conduct of its member. Furthermore, a code of ethics establishes the group as a profession and promote a certain image of that profession to the public. Physicians, nurses, and many other professional healthcare providers have adopted their own code of ethics. A code of ethics is an attempt to define basic rules or principles for determining what constitutes good or right behavior. In other words, to determine what we ought to do next. Ethical principle. Four basic principles form the basis of moral thought in healthcare, supplemented by four rules. First, autonomy, beneficence, non-maleficent or do no harm, and finally, justice or equality. Four basic principles: autonomy, respect the uniqueness and dignity of each person, self and other, respect the person's right to make their own decision, teach people to be able to make their own choices, support people in their individual choices, don't force or coerce people to do things. Informed consent is an important outcome of this principle. This is a form the patient must sign prior to a procedure to acknowledge agreement and consent. The healthcare provider must grant the patient the right to refuse medication, therapy, surgery, and any other procedure. It is both unethical and illegal to use coercion or dissent to promote a reversal of decision. Beneficence: act to remove harm or promote benefit, taking positive action to help others desire to do good. Beneficence can also include protecting and defending the right of others, rescuing persons who are in danger, and helping individuals with disabilities. Non-maleficence or do no harm: prevent harm and removal of harmful condition. Justice or equality: treat individuals equally. For ethical rules, confidentiality obligate healthcare provider to respect and keep secret all information they have acquired about all patients. Veracity closely related to autonomy. This principle binds the healthcare provider and the patient to be trustful with each other and mutually share all pertinent information. Privacy, a person's right to remain private, to not disclose information. Role fidelity, the healthcare professional understands the limit of their professional responsibility and act only within their scope of practice. Ethical issues, moral, ethical dilemma, two or more career principles apply but they support inconsistent course of action. Moral uncertainty conflicts, when a nurse is unsure which moral principle to apply or even what the problem is common with new nurses. Moral distress, when a nurse knows the right thing to do but organization constraints keep them from doing it. Moral outrage, an individual witness an immoral act by another but feel powerless to stop it. Human rights are rights inherent to all human beings, whatever our nationality, place of residence, sex, national or ethnic organ, color, religious, language, or any other status. Basic characteristic of human rights: first, inherent, existing as a permanent, essential, or characteristic attribute; fundamental, a central or primary role or principle on which something is based; inalienable, unable to be taken away from or given away by the possessors; indivisible, unable to be divided or separated; universal, done by all people or things in the world, applicable to all cases; interdependent, dependent on each other; imprescriptible, of right, unable to be taken away by prescription or by lapse of time. Human rights and health care. The concept of human right in patient care refer to the theoretical and practical application of general human rights principles to the patient care context, particularly to interaction between patient and provider, to doesn't limit right to a particular group of people. Human rights to patient, right to get considered and respectable care, right to information, right to give informed consent, right to privacy, right to confidentiality, right to obtain reasonable care and treatment, right to get copies of all medical record, right to know whether patient is part of any trial or clinical research, right to get details of treatment cost, right to expect continuity of care, right to obtain second opinion. Application of ethics in community health by respect people. Consider and treat everyone as an individual who matter, not as a number in a political or social or clinical calculation. Respect participant ability to play a role in determining what they need. Doesn't assume they professional staff or program planners necessary know what is best for a community or individual. Respect everyone human, civil and legal right. This encompasses such issues and non-discrimination and cultural sensitivity. Do what is best for everyone under the circumstances. You aren't necessarily going to be able to help everyone all the time, but you can try to get as close as possible. Don't abuse your position or exploit a participant to gain a personal advantage or to exercise power over another person. This refers to taking advantage of participant or others for political, social, sexual, and financial gain. Don't attempt an intervention in areas in which you aren't trained and competent. This goes along with don't do no harm, but it is not always possible, just as there are times when no intervention may be preferable to doing something counterproductive. There may be times when any intervention is better than none one at all. In those circumstances, you may have to learn as you go, getting all the help you can and hoping you don't do anything harmful. It is important to distinguish between doing what you can and getting in over your head to the point where what you are doing become truly unethical and harmful. Applying ethics in community by ensuring the following: confidentiality, consent, and competence. Confidentiality, no one but The individual working with a particular participant will have access to information about or records of the participant without her permission. At this level of confidentiality, record and notes are usually kept under lock and key, and the computer record should be protected by electronic coding or password. Consent in the case of any major medical treatment surgery. For example, doctors and hospitals generally require an informed consent from as a matter of course. Patients have a right to be told exactly what their diagnosis is, what treatment is being recommended and why, what its risk and advantage are, possible outcome, etc. They also have a right to a second opinion and to refuse treatment. In the case of research, people have a right to know what the research is about, who will see and tabulate the result, what the result will be used for and how, what will happen to their personal record, how their anonymity will be protected, etc. They also have a right to refuse to be part of a study, not to sign the consent form. Both confidentiality and consent bring up the issue of privacy. Competence mean more than simply having the appropriate training and experience. A competent organization hire competent staff member, provides supervision and staff development, and does everything it can to assure that the service it offered are the best available. If service appear to be ineffective or harmful, it is the ethical responsibility of the program to seek out or develop and try more effective methods. If a staff member, even with help from supervisors and others, isn't able to do the job, that should be documented and she should be dismissed. Thank you.